It's now my pleasure to introduce to you Dr. Guy Fragala, who is the Director of Environmental Health and Safety at the University of Massachusetts Medical Center in Worcester, Massachusetts. And he's here to tell us about the success of the ergonomics program at his medical center and his research. Dr. Fragala.
Thank you very much. I'm very pleased to be here this morning to talk about ergonomics because I've been involved with ergonomics for my entire professional career. I'm very happy to see a lot of attention coming into this area because now my mother finally knows what I do for a living. She used to think I was involved with economics. But there is a lot of value that ergonomic offers, and I've seen a lot of this value at our institution, and I'd like to tell you some of the positives that we've had. Back in the mid-'80s, we began looking at our injury rates and saw that nurses were suffering a lot of back injuries. So we said, what can we do about this? Because the traditional programs we were using, such as teaching people how to lift, really wasn't working. So we began by analyzing jobs. And as we analyzed these jobs, we got a lot of people involved. We involved workers, supervisors, or occupational health people, and we saw certain parts of these jobs that we thought we could change. Some of these changes were relatively simple. For example, when we wanted to get a patient from a bed to a stretcher, we began using sliding boards that reduced friction, and it made it much easier for the nurses to get that patient across to the stretcher, a simple, low-cost solution. We put these programs in place, and we did see a reduction in nursing back injuries. A couple of years later, we expanded our program. We began looking at our workstations throughout the medical center. We had a lot of workstations. We began doing training with employees, teaching them how to analyze problems at their own workstations. They were able to make some simple adjustments. We taught them how to make adjustments, how to set up their workplace. And again, we saw a reduction in injuries, more satisfied employees, higher morale. There was a lot that was gained from that. When we looked at our nursing back injuries in 1996, we found that only a low percentage of our workers' comp dollars were being spent in this area. Further, the medical center has taken this knowledge of ergonomics through our occupational health program. We've worked with a lot of industry in the area through our outreach programs, training employees, working with them on developing programs, and people who have embraced these concepts have seen a lot of success. They've seen a lot of good things happening. So again, there is a lot of value to ergonomics. Right now, my hospital has just entered into a merger with another hospital in the community, and just last week we had a meeting on reducing occupational injuries. It was great to hear people talking about ergonomics, how we're going to use ergonomics to further reduce injuries. Ergonomics has been very important to us at the University of Massachusetts. It will continue to be important. I think ergonomics is going to be very, very important to everyone in American industry. So everyone, let's get excited about ergonomics. There's a lot of good things that can be done with these types of programs. Thank you.